It's just a number. Thank you so much for texting, though.
If your period flow has been haphazard, irregular, yeah, so it may be a case of hormonal imbalance, and I'll also advise check with the doctor, but I don't think it's a symptom of cervical cancer.
Okay, so of course, it's not as if cervical cancer alters your period days or the number of your menstrual cycle or something.
No.
Okay, so definitely, but regardless of what it is, the good pharmacist has said you should check with your doctor. You're still listening to Health and Wellness, and we're about to wrap things up. Of course, we're here with Adeoluwa Adegoke. He is the branch manager at MedPlus Pharmacy right here at the headquarters in Victoria Island in Lagos. We'll be giving out your social media handle at some point, so you can reach out to him if you want to have a conversation, or if you want to have maybe a call or have a conversation or consultation personally, because we cannot do the diagnosis via the radio, but then you could always reach out to talk to him much later. Now, this question is one that speaks to treatment. We've talked about the fact that you should not attempt to treat yourself or do things just where you are doing self prescriptions and taking whatsoever it is you want just because you feel like it. Can cervical cancer be prevented?
Oh yes, it can. Because it's caused by a virus mainly. Avoid coming in contact with the virus.
Avoid it. Yeah.
Avoid it. So also,
so generally, abstinence would save you.
Abstinence would save you. Vaccination. There are vaccines for that virus, so vaccination would save you. Walk into any MedPlus pharmacy, and you could get proper awareness of this virus and vaccine, if you like. So that's what I'll say. Okay,
so moving past there, and what is the prognosis of cervical cancer at this point? Like, wrapping that up.
Okay, like I said earlier, the outlook may not be so great, but early detection is key. Early detection is key. If the cancer cells have not spread beyond the cervix, then the patient is most likely going to respond to treatment very well. But once these cancer cells have spread to other organs and then it's all symptoms have started to show, there's bleeding, it's spread to the rectum or to the bladder, the success rate of treatment may not be so great. And I also talked about the health of the patient. Smoking does not really help the cells around the cervix. It can change them, cause abnormal changes and all that. So if this patient is a known smoker, they may not respond to treatment. So I would also advise that.
But what if they start maybe making some general life changes and maybe stop smoking?
Yes, I would advise, if you already smoke, you could start working on it. Just your lifestyle modifications should reflect that you are trying to live healthy. I would always advise that there are supplements you can take that would help just to maintain healthy lifestyle. But the gold standard, like I said, is avoid contact with the virus. Get vaccinated if possible. And that's it. That's how you get good prognosis.
Okay, thank you very much. And so this person just asked this question, but we're already wrapping things up. He says, good morning, guys. Please, I keep getting these very sensitive rashes, sometimes monthly or bi-monthly. During this period, I feel some level of pain urinating. Is this related to the topic? The person, they give us a name, and we're not sure if it's male or female.
Well, if whether male or female, you're having rashes around maybe your genital area, you are having pain on urination. Pain on urination can mean a lot of things.
UTI or something.
Yeah. So, but it's important. Don't self-medicate. Calling the radio station, it's good. You're trying to get awareness, but check with the doctor. Walk into a pharmacy, go to the doctor. Ask. Even if you go to a pharmacy and the pharmacist is something the pharmacist cannot diagnose, maybe there's no proper testing and all that, a good pharmacist will refer you to a doctor,
to a medical doctor.
So it's important that you see a healthcare professional. I would just advise. We can't see your rash. We can't see it. So we don't know.
So
what
we might not
like.
be able to diagnose. Okay. And thank you so much for making out time to be here today. Of course, it's been very insightful for me and everybody listening right now all around Lagos. But then we want to reach out to you. We want to find out, maybe have a conversation with you. Some people are not most comfortable talking about their healthcare issues. They want to reach out to you. How would you be reached?
Okay, you can reach me on Instagram, Ade_Oluwa. You can also reach me on X, that's formerly known as Twitter, _Ade_Oluwa. So it's just, that's me.
And we've had this conversation so far on cervical cancer.
You can also come to my pharmacy for 5 Sakatinumbu.
That's a lot. But thank you very much for coming in today, Adeoluwa Adegoke, the branch manager, MedPlus Pharmacy. The headquarters right here in Sakatinumbu, Victoria Island. Thank